Now, many advancements we're learning here in medical oncology.
Yeah.
We heard it at ASCO in Chicago. We're hearing it now at the ESMO conference here in Copenhagen. And there's so many exciting things on the horizon. With some of these new medical advancements, do you see advocacy changing because of that as well?
I don't know if the advocacy is changing that way, but I think we could influence a lot that the medication changed, because we brought in our desires, or what we really needed, and that is something I think what patient advocates can bring in, filling the gap, really recognizing the needs of patients. And it's not that patients have to survive much longer, but the quality of life makes a difference.
Yeah.
Yeah, if they have to, not to suffer that much from side effects and so. And I mean, I'm in the field of hematology. I'm not so in the oncology, but I know about this as well, because I'm also responsible for 40 different groups in my hometown. It's crazy to explain.
Only 40? Only 40?
Only 40, yeah. So, I mean, I don't have to work really on it. I mean, they work for themselves. And I think that's the important thing, to give people a kind of independency, that they can do what they want to do and how their talents are. And I think in this case, I could encourage so many people to start to be an advocate. Mm-hmm. Yeah. So I think the new medication will make a big, big difference, but even not to all patients. I mean, if you are in a big city, you have access mostly. If you are living in the countryside, it's difficult to get the medications, because the physicians often don't know about it or don't have access to this. But my problem is that in Europe, we have in the eastern part a lot of I don't know, unequal. Mm-hmm. Situations, because they don't have the money to pay for the treatment. Mm-hmm. They don't have access at all. Mm-hmm. And so many of them are asking, for help, that we can, from the western part, fight for them, that they also can have the treatment they need to have, and also the doctors that they can treat like they need to treat, and not like the possibilities are there.
Yeah. Now, I stopped at your table. You have a booth here at ESMO. And I picked up a nice little bracelet, and it says #KnowYourSubtype. Tell me what this is.
Yeah, I'm very proud of this campaign, because many of our lymphoma patients are told they have a non-Hodgkin lymphoma. So when they got to the doctor, sometimes they only are told you have, in Germany, Lymphdrüsenkrebs. Lymphdrüsenkrebs mean glands, and it's not the correct description for this. So knowing the subtype is so important to get the right treatment. Mm-hmm. And there are more than 60 subtypes. And if you want to have some names, what under there, it's Waldenström, it's myeloma, it's follicular lymphoma, it's mantle cell, it's hairy cell. There are so many different names. Right. And patients often get confused when they first get the knowledge of they have lymphoma, non-Hodgkin, and then, later on there comes another name of it, and they think they have a different disease added to their first diagnosis.
Right, and this is just a subtype.
It's just a subtype, and it's an important one.
It's important, right.
Because only the subtypes can be treated in the right way, not non-Hodgkin.
Yeah.
That is like you have an umbrella and it's raining and you take off the umbrella and then all the rain comes on you. Yeah. But you need to have the specific one.
That's right.
Yeah.
That's right.